Hi guys, welcome back to RT Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everybody. Welcome to anyone new. Just wanted to say thank you to everyone for the love and for sharing my content. All right, guys. So thank you. Okay, so today's episode, we are going to break down the barriers to asthma medication refills. So this is just discussing some of the social determinants of health issues that determine whether somebody would pick up their asthma medication refills or not, right? So just to review just a few that I personally have heard and had to address as a case manager or an asthma educator, helping those folks out. Okay, so the first one is gap in knowledge. So basically just not knowing why they're taking the medication that they're taking. Like if they go home with a few inhalers or medication, just not understanding why they have the medication that they have, or it being that they feel better. They're like, okay, so why do I have to keep refilling the medication? I feel better. I don't need the medication anymore. And for us, that is a gap in knowledge, because the reason why you're feeling better is because you are continuing to take you're continuing to take the medication. So the medication is to help you not return back to the emergency room or being hospitalized. And a lot of people, once they feel better, they kind of just stop the medication prior to their provider telling them to stop. And we consider that a gap in knowledge. So that can just be addressed with education. Okay, 2, financial constraints. Okay, so basically just not being able to afford the medication. Okay, so what we have seen, what I've seen personally is a household. You may have a household where a bunch of people in the house have asthma, and there's only one inhaler between, let's say, 3 kids. All 3 of them have asthma, and there's one inhaler, so they're all sharing this one inhaler, and possibly because they just can't afford it, or the copay is too high. And, think of something like a viral infection where one of the kids is sick, using an inhaler, and then now, little Johnny's brother has an asthma attack, is triggered, and now he needs to borrow the inhaler. So that's why we try to find out why, why that's happening in the household and help out. And also, here's another one. There are folks who take their inhaler, right? They take it apart and they take the canister, and what they do is they refill it on their own. I've heard this personally. So patients, or, they'll say, yeah, I have medication all the time because I refill it by myself. And it's like, okay, well, do tell. And they're like, yeah, what they do is they put the canister, and they run it under the tap water, and they fill it up with water, right? So now they put it back in, and they believe they have more medication. So yeah, don't have to refill it. All right. And once again, what we do is we try to figure out, is this an gap of knowledge, or is this a financial constraint? There are cultures where, for example, I'm Haitian, and I'm Haitian American, and what we have done in what we've seen in different households is to extend the product. There's no wasting in the household, right? We don't waste food, big policy. So, you put water sometime to extend the product, right? Just a little bit of water just to get like the whatever's left in the jar. And so, sometime people apply this to medication. So just, look into that, try to figure out what what the culture is behind that, and just give them whatever resources that can help out. Okay, so yes, that we have another one is just folks not having time to go pick up the medication from the pharmacy because of work. It might be a single parent who has 2 jobs and simply just doesn't have the time to go pick up the medication. So we have heard that, like, I just didn't get to it. So we'll try to provide resources to help out with that, whether it be some kind of delivery option from the pharmacy or just another option. Another one is housing condition. I've done home environmental assessments where I'll ask, hey, Ms. Jackson, so where do you store the asthma medication? Where do you store your controller meds? And they'll be like, oh, it's somewhere. It's somewhere in the house. Right? Or they'll, it's buried on top of clutter, and sometimes they're having a hard time finding it. So it might be the housing condition and the medication not having a proper home in the home, right? So that's another one. And I wrote down also just not having social support, just not having that support system, and something like medication, getting your asthma medication refill can simply just slip your mind. You don't have someone to remind you. You don't have it's just, you have a lot going on. And so once again, just not having the social support. So trying to link that person maybe to some type of social services and other linkage of care that can help out with that would help the person. Mental health. We've had interactions with patients or people who just is like, picking up my medication, I couldn't even get out of bed today. You understand what I'm saying? So, just dealing with mental health issues and depression. So we have to think about this as well when it comes to asthma management and helping find resources to help with that. Transportation. Once again, we were talking about the pharmacy, the time constraints of work. And then sometimes you just have folks that just don't have any way to get to to pick up the medication, to the pharmacy, or even, to get to the doctor's appointment to get the refill, right? So, transportation. So thinking about stuff like that as another way to help out, any resources that you can have to help in that aspect. And social influence. So just things like, maybe their family or friends, or, they've seen something, from a random YouTube footage or whatever, and just getting the idea or getting influence that they don't need the medication anymore, or that it's just not for them. So these are things that we think about when it comes to progressing someone towards asthma control, and thinking about the barriers. So when someone had asthma medication once upon a time, and now they don't have the medication anymore, or they're not picking up their refills. As part of the asthma program, we were also a part of population health. So we would, get reports to show people that were not adherent to their treatment plan. So they just weren't picking up their medication. And so it was our job to do a root cause analysis, just basically find out, well, what were the barriers, and then help plug in whatever help resources that we can offer to help them get the medication. Because it doesn't matter what type of asthma you have, whether it's seasonal or if it's not that, if you feel like it's not that serious of an asthma problem for your child or whatever, what we always say is that everyone with asthma should have at least the minimum of rescue inhalers, so something. And so that's why we review, okay, well, tell me, how's it been going with your asthma medication? And so from there, what we see, okay, does the person have anything at all? All right. So yeah, so those are the things. And so when it comes to the social determinants of health, we just always want to try to review them and understand them, being empathetic, and then linking the person to whatever quality resources that we have to offer, and that helping them manage their asthma. All right, guys. So I hope you learned something here from me today. Let me know if I missed something. Once again, I'm just giving stuff that I personally have seen. Maybe I've forgotten a few, culture. I think I mentioned culture already, but if you know anything else, chime in, put it in the comments. Love to hear the feedback. So yes, guys, so remember that we are growing together. So much more content to come. I have the guest co-host lined up. I have other things going on, and I will be releasing very soon. Super excited for what is to come. So yes, thank you. So remember, we are here every Wednesday on most podcast platforms on Wednesdays, and we are here on YouTube every Thursday. So yeah, so I will be seeing you next week. And remember to invest in yourself and to only compete with yesterday's version of you. See you. Bye.